Good afternoon. I want to talk about epilepsy and cannabidiol today. I'm going to go over the common reasons that are given to the cause for epilepsy and talk about cannabidiol and what role that it could play in this condition. Now, I've got a lot of material to cover. I will be moving quickly. My background has been in family practice. I have a broad number of experiences. But I've been reviewing cannabidiol for the last 3 years, and some really exciting information continues to surface in the medical literature. I'm excited to relate some of those things that I discover as the information continues to roll in at a steady pace. The main problem with epilepsy is this huge burden of disease that we encounter. We'll talk about some of the conventional causes and the treatments, and we'll talk about endocannabinoid deficiency as well. I'll go over some of the CBD benefits and management practices, and we'll have a question and answer period at the end. So the burden of disease for epilepsy is on the order of 3 to 5 million people in the United States, probably 50 million in the world at any one time. Most people don't get therapy in third world nations. The cost is too expensive. But as a total cost in the United States, we're seeing about $2.5 billion. I think that's probably a low estimate. Each individual who is poorly controlled is costing at least $10,000 a year. So those costs add up quickly. And we do see approximately 70% of people controlled with medications, and they seem to be pretty good for most of the types of epilepsies. But there's quite a number of different ones. Now, death is relatively rare in epilepsy, but the sudden, undefined reasons for epilepsy representing the SUDEP is about 9 times the incidence in the normal population. So it's not a huge number, but it is considerable, and there's not a good explanation for why that's happening. In fact, there's very poor explanation for epilepsy in general. If we break down the epilepsy into the different types, these are descriptive elements. They're not really defining exactly what's going on. Mainly, it's a division between the generalized and the partial. The generalized meaning both sides of the brain, and the partial meaning just one hemisphere. And then you see some of the breakdown here as it's descriptive in terms of the partial seizure, the tonic-clonic, and the other types that are listed, including absence. The causes of epilepsy, there's actually quite a number of genetic components to epilepsy. They're not absolute, but they're a relatively predilection for epilepsy. So there's probably some of the environmental causes and some of the signals. Things like flashing lights can put somebody into a epileptic state in the right situation. Probably the genetics has to deal with predisposition and some decrease in the functions of some enzymes and transmitters within the body. Scar tissue can form as a result of injuries or lesions that occur, let's say a small mass or a cyst that might be there. Tumors can also cause seizures, but it's relatively rare. Probably less than 4% of total seizures are related to tumors. Toxins is one that we speculate about, and some chemicals can induce that seizure episodes. And of course, infections, whether it's viral or bacterial, they could be the harbinger of something major going on with the first seizure that's there. Now, all of these things seem to have a fairly common pathway. But the way that we're currently looking in the contemporary medicine epilepsy is that it's a focus of synchronized electrical conduction that goes across major areas of the brain. So the whole brain has almost like a short circuit that's occurring that sends the brain into the same pattern of activity repeatedly without the ability to recover very effectively from that. Now, normally when a neuron fires, it has a period afterwards where it won't fire. It stays fairly quiet. But in epilepsy, there's this synchronicity that occurs with all of the cells. So they're all firing in the same pattern, and there's a great decrease in that period of time where they are not firing. That's a major way that epilepsy is looked at in modern medicine as this electrical conduction, and what can we do to interrupt that conduction circuitry. Now, that may not be the best way to look at things. We do have, in terms of conventional treatments, we're looking at a number of different anti-epileptic drugs that are actually quite effective, but they are associated with a number of adverse side effects from them, whether that's weight gain or that is cognitive loss or depression, especially in those seizure disorders that are having some sort of difficulty, that are very difficult to control. One thing that's not been looked at very much, except in recent times, is the problem of endocannabinoid deficiency in the brain. What PET scans have shown and patterns is that the endocannabinoids are disrupted. There are problems in this area with excess numbers of CB2 type of receptors. This seems to be a general response in the brain to traumatic situations and to inflammatory signals that the brain is looking, and any tissue is really looking for ways to reduce the inflammation, and the CB2 receptors may be the pathway for that, using some agents that will act on the CB2 receptors. There's also low levels of endocannabinoids, and this suggests that there's an endocannabinoid imbalance that's occurring. The clinical endocannabinoid dysfunction or deficiency that we've talked about with other conditions such as PTSD, migraines, irritable bowel syndrome, and chronic fibromyalgia. At the same time, there are increases in the endocannabinoid system types of enzymes, with increases in cytokines, with inflammation that's going. So there's a lot of activity that is happening with in the brain with respect to the endocannabinoid system, but it's not very functional. And this may be a key area for the role of some phytocannabinoids in order to get that under control. A more recent way of looking at some of the disorders that are going on in the brain is to look at the support cells that are helping the neurons. So much of the energy and focus has been on the neuron itself. Maybe we need to look at the glial cells, these supporter cells that produce the inflammatory cytokines that occur within the brain area, as well as providing the pathways for destruction of some of the neurotransmitters that are there. So one of the problems that we see with seizure disorder is this excitotoxicity that occurs with certain of the neurotransmitters. The brain's not easily able to control some of these reactions and the response to the high stimulation that occurs with epilepsy and some traumatic situations. And it relies on these glial cells, particularly the microglia, to protect the brain and break down these products so that it becomes innocuous and it won't cause any problems. In addition, the astrocytes maintain the blood-brain barrier so that they keep abnormal substances that are okay in the rest of the body but would be irritating to the brain out of the area of the brain in that blood-brain barrier. And these glial cells perform essential functions in protecting the brain and maintaining an anti-inflammatory environment. Unfortunately, some of the evidence is showing that these pathways break down, and there could be some major problems and potential for what the phytocannabinoids and other approaches. So the new concept here is that the astrocyte or the glial cell is at the core of what's going on with epilepsy. That I've listed off a number of these factors on this diagram showing the disruptions that can occur and how the astrocyte is really at the hub of a lot of these changes that are occurring. If we can address these cells, and these cells also are your primary macrophages that occur in the brain. So they are inflammatory, they have an inflammatory or an anti-inflammatory role as well, immunologic role, and including the gap functions that occur in the blood-brain barrier and as well as within some of the cellular neurotransmitters. All of these things are going on. If we can focus on the glial cells and the astrocytes, we may get better handling of epilepsy for many individuals. So what we're seeing with cannabidiol is specific action on these glial cells, where it blocks the inflammatory cytokines that are normally released and normally signaling within these types of cells and for the neurons in the same area. It's blocking the reactive oxygen species in the same area, so it's reducing those inflammatory substances and those toxic substances. It's enhancing the mitochondria, so they're going to be performing better at higher energies, even when there is less blood supply or oxygen available. They're also restoring cellular processes. Now, a number of cases where we've had children with inborn errors in metabolism and some of the severe cases of epilepsy, they do have genetic defects and some of those cellular processes are not working properly. What we're seeing with cannabidiol is a restoration of some of those processes. At least they're not causing inflammatory adverse reactions at the same time. And furthermore, the cannabidiol is preventing cell death, particularly the neuron cell death. We want to preserve as many of those neurons as possible. If we look at the overall effects on the brain of cannabidiol, it's stopping the inflammation. It's reducing the number of immune cells, a process called gliosis, where the macrophages of that particular region populate the area and put out quite a few of the inflammatory cytokines, as well as attract other macrophages to the area to address any type of infection or a traumatic situation. Cannabidiol specifically regulates the cellular component of this process, so it reduces the formation of those inflammatory collections of cells. It's also restoring neuromodulation. So we talked about some of the excitotoxins that can occur and some of the other neurotransmitters. What cannabidiol is doing is getting those back into balance, and so the body can maintain homeostasis. It's also promoting the new synapses and neurogenesis, so the formation of new connections. And this is so important in young children who are dealing with epilepsy because they're not making the same development as would have adults who have already acquired that. So it's important that this possibility be there. And the chance of recovery for someone who has those impairments is very, very good. We mentioned earlier about cannabidiol restoring the blood-brain barrier as well, working on those astrocytes that control that blood-brain barrier, maintaining the impermeability of the blood-brain barrier to keep out those substances that would be inflammatory in nature. And it's upregulating the endocannabinoid system to get it back into balance so the body can restore homeostasis. Now, I want to talk about some of the things about the positive things that we're seeing with cannabidiol in epilepsy. It's clearing the cognition, the mental functions that are normally there. It clears them quickly. Normally, after an episode of seizure, there's a postictal phase that can last for hours. That is significantly shortened with cannabidiol being on board if we haven't stopped the seizures. But I think that is a good indication that cannabidiol is really doing some hard work there. Even if it's not up to the level to stop the seizure, it will block a lot of the adverse events that occur with it. It's restoring memory. It's enhancing the learning and development of many of these children that I've been working with. And you also see the benefits in the area of behavior, activity, sleep, learning, mood, and the social behavior of these kids. So recently, and working with Epidiolex is the pharmaceutical cannabidiol that's available currently undergoing phase 3 trials. And these are some of the results from those trials. And what's remarkable in these results is looking at the response to cannabidiol, the number who have had a seizure increase, none. The number who had no change. Yes, there was a small number who had no change, and then you see there's increment, but strikingly, you've got more than 80% decrease occurred in almost 50% of the kids that were using this pharmacologic agent that is a isolate and a pure extract and not the whole plant. And then look down at the side effects due to cannabidiol. You may not be able to read those, but they are listed here as appetite decrease, very minor, and some fatigue and drowsiness. These kids were using very high levels of cannabidiol on the Epidiolex. On the other hand, they listed off a number of these side benefits here with better sleep, increased alertness and better mood, and decreased self-stimulation. So all of these things, marvelous response to using the cannabidiol with Epidiolex, and just think what kind of response you're going to get with a whole plant substance that comes from something like elixinol. Now let's go into some of the therapy guidelines. I'll have talk about starting off with a standard serving twice daily. So that is the basis for where we begin. For an adult, that's on the order of 15 milligrams twice a day. For a child under 7 or over 70, yes, a child over 70, will require probably start with half that dose and then make adjustments. The adjustments, if the individual is using already some of the other anti-epileptic drugs we call AED, then the increments should be slow because you want to make sure that you're not going to run into any problems because of some interaction. And we'll address interactions on the next slide. You can use it orally, but there's also the option of using cannabidiol topically, putting it onto the skin in those situations where you need to get cannabidiol into the body and into the system, and you may not have oral access. The duration is usually 6 to 12 hours, and so typical dosage may be 4 times a day, or it may be just 3 times a day. Everybody is metabolizing cannabidiol differently, so you're going to have to find out for yourself. A target range for most uncomplicated types of seizure disorders is in the range of 1 milligram per kilogram. So that's just a general area. I can tell you from the medical literature that the suggested average dose of cannabidiol was on the order of 6 milligrams per kilogram. And I've used in some resistant cases as much as 12 milligrams per kilogram. But I'll have to say that most of the time I get really good response at 1 milligram per kilogram in that particular range for most of the clients that I've been working with. I believe that's because this is coming from a natural plant source, an organic plant that has a full entourage effect that's there. So what about drug interactions? Well, before I get to that, I want to talk about the ketogenic diet. And the reason I bring that up is because the ketogenic diet was the approach that was used for epilepsy going back to Greek times. And even within the Bible, there is mention of using a fast in order to control seizure disorders. And it was revived in about 1915 using a ketogenic diet, and about 50 to 70% of kids can be controlled using a ketogenic diet. And the reason why is that it uses a signaling property to go to the nucleus. And at the nucleus, there is a specific receptor called the PPAR receptor, and this is gamma type. And those particular fats and the ketones signal that receptor to produce the anti-inflammatory substances and to shift the body into a situation to enhance the anti-epileptic conditions and environment. There's anti-inflammatory effects that occur with it. And the other reason I bring this up is because the high-fat diet and the low-carb diet is also enhancing the endocannabinoid system. The endocannabinoids and many of the molecules that are there are lipid in base, and so they need a continuing supply. That includes omega-3s for sure, but it also includes saturated fatty acids. These are precursors for some of the endocannabinoid system. And one more thing that's really important is that cannabidiol is using the same pathway, the PPAR gamma pathway, to signal the nucleus to shift in its production of cytokines and inflammatory substances, and change the environment and even the epigenetics of the cell and how it works. So with respect to drug interactions, here's a collection of many of the anti-epileptic drugs that are available on the bottom range. And you see a number of studies have been done, and they show very clearly that there's quite a variation that in the drug levels of these substances when cannabidiol is used. In some cases it goes up, other cases it goes down, and it's pretty well all over the map. So there's no reliability that cannabidiol is going to push any medication in one direction or another. And so you can't rely entirely on that. You really have to be in a situation where you are going to be using cannabidiol, making small increments, and making adjustments in the other anti-epileptic drugs, because these are the ones that have side effects. These are the ones that are going to produce symptoms that are going to cause some concern and challenge for controlling the seizures. Sometimes when those levels drop, there's going to be increased seizures, and when they increase, there's going to be drowsiness or there's lethargy. You'll have to go clinically and watch these things. It's not dangerous. We don't see any major problems. You have CBD on board to protect against neuron damage and status epilepticus. So there's not any great danger in this process, but slow increments on a weekly basis of about 10 to 15% of the original dose is an excellent way to move forward in using cannabidiol for seizure disorders. So let's go over some of these things. Once again, we'll talk about the huge burden of epilepsy, $12 billion on a yearly basis, and quite a huge toll to the family in terms of caring for people with this problem. The endocannabinoid deficiency is present here, as I've talked about in many of the other conditions. That CBD addresses the real pathways that are involved with epilepsy and controlling epilepsy. And CBD is supported well in clinical and preclinical studies and practice for how it can control many of the conditions related to epilepsy. And then the pharmaceutical drugs that are being evaluated now, it's showing a consistency there as well with a high rate of success and no significant adverse effects, toxicities, or drug interactions. The dosing is quite variable, and there's a lot of adjustment that has to go on with that. So that's really the end of my discussion. I wanted to address all of those things, and I want to address any questions that you might have as well. And you can put those questions into the group chat, and I'll try to answer those. I have put references and slides into a folder that is available to you by copying and going to that particular address, and you can see those folders and files. It's been a pleasure to talk to you about this condition. It's one of the most frequent areas of concern that people have, and it is a challenge to work through these particular conditions and the epilepsy, but it can be so rewarding, especially in children, to see their impairments disappear and for them to start learning and behaving like normal kids again. So thanks a lot for being here to listen to this. And we'll be working on other lectures in the coming weeks. So now I'd like to take any questions that anybody has. You know, with respect to those medications that I listed as the AEDs, I've really encountered only one that has consistently been reported in the literature. It's clobazam. And it's been documented to have high levels when using cannabidiol. And this is all going through the CYP 450 system and the different pathways that are there. Some further looking at the CYP 450 is that actually it requires fairly high levels of CBD in order to inhibit those particular pathways. And looking in further detail on it, these anti-epileptic drugs can also affect cannabidiol and raise or lower the levels of the cannabidiol as well. So it becomes a little bit of a challenge, and that's why it's much better to move at fairly slow rates, changing, as I mentioned before, 10 to 15% on a weekly basis, and adjusting for changes that occur in the individual. Now, usually when I talk about cannabidiol, I'm talking about raising the level rapidly, doubling the dose or making some quantum improvements and changes in it. But in this case, I think it's wiser to go a little bit slower. I'd say a week. I'm not convinced that you need to wait that long. I think that 3 or 4 days is sufficient. I know that Realm of Caring does suggest that a week is their standard, and they move up very slowly when they're using cannabis type of compounds. Now, currently, I've got clients in Australia and India that I'm working with respect to seizure disorders. The clients in Australia had an interesting episode. I think I should tell you about that. They had been using cannabidiol for 2 years, very successfully, complete control of the seizure disorder, as well as continuing development, growth of the child, and she was doing quite well. But suddenly it stopped working, and she went back to having seizures. And of course, everybody's frantic exactly why this happened. There's a peculiar phenomena that's occurred that has been talked about by Bonnie Goldstein addresses it, where there seems to be a saturation of the cannabinoid receptors, or whichever receptors are involved, because CBD has a low-level interaction with the endocannabinoid receptors specifically. It does block the FAH enzyme, so that when that does that, it blocks the breakdown of the endocannabinoids specifically. But the point is that CBD doesn't have a great deal of interaction with the endocannabinoid receptors specifically. Most of its action are occurring outside of the endocannabinoid system. But there seems to be a saturation that occurs at some point, which the cannabidiol doesn't work. Uniquely, by stopping the cannabidiol for approximately 2 days, there was a complete recovery and actually an increased sensitivity to cannabidiol for better control of seizures. So the entire event was passed in a matter of 2 days as a result of briefly stopping the cannabidiol in order to rebalance the endocannabinoid system in that situation. Well, until next week, then I'm going to say goodbye.